Greetings and good evening, everybody. If you're watching on Periscope, you're watching on POLYBI, the number two. If you're watching on YouTube, you're on Radio Don 1. And if you are watching on Twitch, uh, A, thank you, it's a miracle, and B, it's Radio Don 55. Well, um, day 7 of my enforced social separation. And by now, you probably know what is happening here in California. It started this afternoon at about 5:30 our time, when the mayor of Los Angeles, Eric Garcetti, basically set in motion something called Safer at Home. Basically, it was a citywide order to stay home, hoping that might be something that could flatten the curve, as they say, and increase the possibility that we may get out of this COVID-19 deal that we're all scared of. And that was followed by our governor, Gavin Newsom, doing the same thing, only for the entire state of California. California is number 2 in terms of number of COVID-19 cases that have been that have tested positive, and also in terms of deaths. Unfortunately, we just suffered another death here in LA County, which brings our number to 2. There were some really dire projections that were made by our governor and communicated to the president today, asking for help, including a medical ship that would be parked outside of either the San Francisco harbor or the Los Angeles harbor, depending. Now, this is not, you are going to be in your house or you get arrested. That's not what's happening here. Basically, you have been ordered or instructed, or however they're going to do it, to stay at home, not have any gatherings in your home of more than 10, no gatherings at all of more than 10. Make sure there's plenty of disinfectant and hand sanitizer in your home. Observe the 6 feet of separation rule. You can leave the house for things like going to the food store, going to the drugstore, going to your local hardware store, what is called essential duties. But anything else, like going to Best Buy or something like that, that's out of the question. Part of that is that the city, and now the state, is ordering all non-essential businesses to close down. That includes car dealerships, that includes barber shops, that includes a wide range of stores. I just got a backpack yesterday, just in time, I must say. Now, like I said, food stores are going to be open, drugstores are going to be open. They said dry cleaners will be open, which may also include laundromats, because you got to have your clothes clean and all that. But the non-essential things are going to be closed. In terms of enforcement, they're allowing what they're calling isolation shame to take take hold. Basically, they're asking us to sort of like police each other. You know, do the shaky, shaky shame on you if you're out and about doing stuff other than going to the food store or Walgreens or whatever it is. No, they don't know when this is going to be alleviated. They don't know when they're going to clear this. But what they're trying to do is they're trying to flatten out what they call the curve. There's a great big spike that they're seeing as happening around the globe in terms of people catching the disease and actually having to go to the hospital and actually dying. And they're trying to shorten that curve as much as possible. Now, in terms of people in my situation, here's how that's going to work. They're going to try to get as many people who are, as I say, a rough sleeper into places as soon as humanly possible. That's what they are saying. They are trying to negotiate with several motel groups, several other lodging places. And I would probably think that if the state's paying for it or the city's paying for it, uh, those people who are doing lodging will be very happy because vacancies are going to go way up. Travel is done. So what they're going to try to do is they're going to try to put people into those hotels, observing, of course, the 6 foot of separation deal. So in some way, this is going to be maybe a good thing for me. I don't know. Look, I know I'm not the most coherent person in the world right now. And I know that it's kind of scary. It's kind of scary for me because of my age and other situations. It's probably scary for you. Because when something happens and one of the outcomes is death, it does get scary. Now, they keep telling you that most people who will get this, even people who have the compounding pre existing problems that everyone is talking about, will probably suffer basically regular flu like symptoms. You're going to feel lousy for about a week and then you'll get better. And some people will carry the virus and they will be asymptomatic. You'll feel fine. But because you do have the virus, um, you may wind up infecting somebody else, which brings us to testing. I would love to have universal testing. I think a lot of people would like to have universal testing, but right now, because of the lack of test kits and things like that, they're asking only people who are having symptoms and may also be in some of the areas of most of bigger concern, places people like me who will be a 65 in a few days, people who have ongoing health problems, folks like that, to get tested, but only if you have symptoms. And that basically is part of the problem that we have because in a lot of these places there has been something close to universal testing. In China, where this whole thing allegedly started, they are there are no new cases forming, and that is good because number one, it's good for the folks in China. It's also good for us because we can see that, and we can see that there is a light at the end of this tunnel, and it is not an oncoming freight train. Look, I know I'm not going to get a lot of views because, like I said, I'm just talking off the top of my head and my And my abilities as a communicator have deteriorated a lot over the years. But if I can tell you one thing, I have said on social media many, many times that we do need something that would affect everyone, that is really bad, that would force us all to help each other. And that is what is happening right now. We are being forced to help each other survive this, not just in terms of your health, but basically in terms of your mental health, in terms of family, in terms of community. Staying at home may very well be the best thing that you can do for yourself and for your community. Because if you don't have it, you don't have that much of a chance of getting it. And if you do have it, you don't have that much of a chance of spreading it. But I think when we come out of it, we will be better people because we are going to look at a lot of the things that we've been carrying around as BS. I think that we're going to be better people, will be more together. I think something good will come out of it because this very well may be the thing we need to stop having all these armed camps all over the place. Everyone is helping each other, no matter what your politics are or your orientation is, or color, or gender, or whatever. There's a lot of things that have been hashtagged in the last few months that have not been talked about in the last 2 weeks. And I think that is a good thing. Well, you can tell I'm pretty tired right now and I'm going to go to bed. But if you would like to help me out a little bit, there's a little website address at the bottom of this. It's connected to PayPal. Um, a few tokens wouldn't hurt. And I also would like to thank those people who have been very patient with me. I have not been able to get on for a few days because I didn't have the ability to charge my phone. Hopefully that will be a thing of the past and we'll be able to continue on. We still are going to be doing a lot of stuff, but we are going to press on and we're going to be with you as much as possible. I think it's important for us to be together, to be with each other, to be for each other at this particular point in time. And that's all I have to say, folks. If you are wanting to comment on this, you can comment on Twitter at POLYBI, the number 2. You can comment on YouTube right below this video. You can comment also on Twitch. There's a segment we can do that. Please be kind in your comments, and I know you probably have heard this a million zillion times in the last few days, but please do stay safe. Stay at home. Watch a movie. Reacquaint yourself with your family. We'll all be fine. We will all be fine. Good night.